it was going to overlap on my appointment with him, so we canceled that and set up an appointment with you instead.
Okay.
So I actually see him tomorrow.
Okay. Well, I would rather you meet with him and then meet with me, but we can go over what this regimen looks like, and what you might expect from it.
Yeah.
You can ask any questions that you have.
Sure.
If I don't know the answer, then we could make a list for you and Dr. Lonergan tomorrow.
Sure. Yeah.
So I can tell you a little bit. Have you ever had chemo before? Brandon?
Never been hospitalized. Never been sick. Never.
Okay.
You know, when I did something, the first time I did it, it's big.
Yeah.
He's a tough guy.
He's a tough guy. Well, let me just tell you about chemotherapy. Are you in the medical field? Did someone tell me that?
Yes, I am a physician assistant.
Okay, at the Coast.
At the Coast.
Okay,
yes.
Okay. So you know some stuff about. It's different when it's you, though, isn't it?
Oh, this is definitely beyond my pay grade. That's for sure.
Okay. So this form here, I'm going to give you that. Got her phone number in the corner. Dr. Lonergan is your doctor, and Rituxan Epoch is what we call this regimen. I wrote it out individually by drugs on this card, but this paper here is for you to take home and put on your refrigerator. If you called in after hours and got a different doctor than Lonergan, they're going to say, what regimen are you on? And Rituxan Epoch, everybody in the place knows exactly what that means. These are potential side effects of chemotherapy in general that we want you to report to us.
Okay.
This top one here is a fever of 100.4. Pretty low grade fever. Super important for you anytime, day or night. If you have a fever of 100.4, we want a phone call.
Okay.
Shaking chills with or without a fever. I don't expect you to have that. Occasionally, the first time we give rituximab, people have some chills while they're in the chair, riggers. Most people don't, but some people do. And once in a while, that happens once you get home.
Okay.
I've seen it just a couple of times. So if you called in after hours, after the day you got Rituxan and had chills, they're going to have you take Benadryl and Tylenol. I made you a little list here of a little grocery list. So Benadryl and Tylenol would be great to have on hand.
Yay.
You know what all those things are and what they're for. New cough, shortness of breath, we want to know about it. Uncontrolled nausea and vomiting. So we will give you nausea medicine in your IV. Probably give it to you every day because you're going to come in and refill this chemo every day. And he'll give you something to take at home. So there's no reason why you should be vomiting.
Okay.
So call us if you use the medicines as prescribed and you are nauseous or vomiting, then call. One of the nurses can help walk through the regimen with you and make some changes.
Sure.
Okay. If you have diarrhea, Imodium.
Okay.
That's what we recommend. Sometimes we fix one problem, cause the other. You know that. Yeah. Any unusual bruising or bleeding, we want to know about it. So sometimes people's platelets drop, and we see some unusual bleeding. So if you had a bloody nose that wouldn't quit, some sort of bleeding that doesn't belong, we want to know about it. Uncontrolled pain, we want to know about it if there's a change. If you get sores in your mouth, we want to know. This saltwater baking soda, swish, is a great preventative.
Okay.
Do that a couple times a day. Adriamycin, one of the drugs that we're giving you, does cause some mouth sores sometimes. So there's a prescription for that.
Sure.
If you triple mix, we call in. So call us if you have that problem. If you do that, I think that'll help. If you get a rash, we want to know about it. You should not have a rash.
Okay.
So if you get a rash, we want to know. Constipation is a bigger problem for most people. There's some information here in the book. We'll go over that. You know how to manage that. Excessive thirst and urination and change in level of consciousness. These are things we see more with immunotherapy than with chemotherapy.
Okay.
Obviously, we want a phone call.
Okay.
So I'm going to give you this little magnet here. You can take this home and stick it on your refrigerator. So if you called in after hours, you're probably not going to get Dr. Lonergan. They take turns being on call. So you have everything you need right there.
Sure. Okay.
Whichever doctor. This card's the same thing. Phone number, the names of these drugs that he's going to give you, and Dr. Lonergan's team. Pegfilgrastim is a white blood cell booster. They're going to put that on either put a little contraption on that'll give you the drug in 27 hours. I think that's the way he has it signed up, set up. But sometimes they have you come back the next day and get a shot.
Okay.
So it looks a little bit like this. They sent us this model, but I've never seen one look exactly like that. It's about that size. Goes on the back of your arm, right here, or on your stomach, and 27 hours after treatment, it'll give you pegfilgrastim.
Okay.
That drug causes some bony aches, sometimes pretty significant bony aches, and we have found that Claritin helps a ton with that. So take that the day that we put the on-body injector on you, and for a couple of days, 2 or 3 days afterwards.
Okay.
Any questions so far?
You mentioned refilling this. I understand. I think am I gonna be inpatient the first cycle of this?
I don't know the answer to that. We do it in clinic here. Whether he's going to do it inpatient for you, did you guys talk about that?
No, not yet. So,
yeah.
Okay.
So typically what it is, Monday you would come in and you would get the rituximab, which takes a little bit of time. The first time we give Rituxan, we go really slowly. Some people have a little hypersensitive reaction to it. We know what to do. Just let us know if you feel anything weird while you're getting the infusion. Most people don't have a problem. So that'll take a while of Monday, and then they're going to put a pump on you with a bag that has 3 different kinds of chemo in, and those go for 24 hours.
And do I go home with that, or
you go home with that?
Okay.
Yes. And so if you finished at noon on Monday, which is energetic because it would be probably later than that, with a 24-hour pump, Tuesday you'll come in at noon, and then they'll take that pump off, give you a little bit of nausea medicine, and then they'll fill it, and then they'll put it back on. Pushes it out about an hour a day, just because it takes them a while to make the new bag, and then you come back again in 24 hours. Does that make sense?
Yeah.
So then by the end of the week, you've gone later in the day because moves it up. And then the last day, Friday, they give cyclophosphamide, which is another drug, and then they'll put that OBI injector on for the white blood cells.
And that is until the weekend?
It's 27 hours after, and they'll give you a little video to watch before they put that on, and they'll give you a little card. It's really super clear. Super clear. If you leave here at 4 on Friday, 7 o'clock on Saturday, it's going to beep, and then it's going to give you the medicine over 45 minutes.
Okay.
And then when it's done, you just peel it off, put it in a little red sharps container that they'll give you.
All right.
Take some Claritin with that. So that's kind of the schedule of it. I will tell you. I'm going to give you this information about rituximab and EPOC, and I'm just going to send this home with you. You can read through it. They list every possible side effect of anybody ever had ever, so take it with a grain of salt, but read through it, learn what the risks are. In the back of it, we have medications that can interact with it. Any prescription medications that we know about, Dr. Lonergan's already checked to see if they interact, but anything over the counter, we've got quite a list. We just want you to be careful. Anything over the counter. St. John's wort's over the counter. Grapefruit juice and starfruit are on everything. And usually cimetidine. So anything, if you started any sort of new medication, you want to make sure you take this card with you and let the pharmacy know that you're on these medications. In the back, these pages show the most common side effects, and if it says common, then it's more than 25%. So risk of infection, hair loss. I believe that you will have hair loss. These drugs usually cause total hair loss. Anemia, risk of bleeding, neuropathy. I've seen some neuropathy with it. Wouldn't say it's a given, but